Hello friends, I am Dr. Jaydev Panchwagh. At our Hemifacial Spasm Treatment Center located in Pune, in India, we have been treating hemifacial spasms for the last 20 years. We perform microvascular decompression surgeries or MVD surgeries on these patients with the aim of curing this problem permanently. Many of our patients have requested me to make small videos about how exactly the blood vessel causes compression on the facial nerve, which in turn causes hemifacial spasm. As you all know, hemifacial spasms are the spasms which occur on one side of the face. In this particular patient, the video of whom I'm going to show you here, the spasms were on the left side of his face, something like this. You observe my face, I will show you. So the spasms would start like this while he was speaking to people only on one side. His eye, cheek, and some part of the neck would continuously and uncontrollably contract, something like this. It was extremely embarrassing, and he was reluctant to take part in social interactions. So what you see here is very high definition endoscopic view of the facial nerve deep inside the brain. The pink large blood vessel that you see here is called as vertebral artery, and this artery is not normal in its caliber and shape. It is elongated and more curvaceous than normally it is. If you see very carefully, just below this artery, there is another artery, slightly reddish in color, and which is hugging it very closely. The part you see here is the facial nerve. This nerve, as you can appreciate very clearly, has become thinned out in this portion because of repetitive pulsations of the blood vessel against this nerve. This video is after performing some initial dissection, and I have dislodged this blood vessel from this deep depression you can see in the facial nerve. And you can see how continuous pulsations were hammering this area, causing deep depression in the facial nerve. So this is actually the cause of hemifacial spasms. Such pulsations which continuously hammer the facial nerve in its most proximal area, also called as root entry zone, cause changes in the nerve, and the nerve starts firing indiscriminately, causing hemifacial spasms like this. In this surgery, we remove this contact by dislodging very carefully the blood vessel from the nerve, and then we insert a thick padding of teflon between the blood vessel and the nerve, and the spasms are cured. So everyone who is suffering from this horrible disorder should know that this problem can be potentially and permanently cured. And this is the message that we want to give at our Hemifacial Spasm Center. I will request all of you to spread this message to everyone who is suffering from this problem and assure them that there exists a center of excellence for this problem, and hemifacial spasms can be permanently cured. Thank you very much for patiently listening to this video, and please join us for the other videos that we create every week about hemifacial spasm.